And so there are a lot of symptoms, both for people with celiac disease and for people with gluten sensitivity. And it's such a range, and part of it is when you look back at what celiac disease is, it's a disease where you're basically not absorbing nutrients, and so that can show up in such a variety of ways, from people who have skin conditions to people who have hair loss to people who have migraines or joint pain. Such a wide range of things. Some of them make sense, like the fatigue or anemia or low vitamin D or osteoporosis, because your body really isn't getting what it needs. And the other ones like IBS or bloating or gas or diarrhea also really make sense because things aren't being digested in a proper fashion. Another one that's very common is lactose intolerance. Part of what's going on there is when we talked about the villi, lactase, which is what breaks down the lactose in milk, is one of the things that's in the villi. And so when those villi are broken down, you're basically losing the enzyme to digest milk. And so lactose intolerance is actually really common in celiac disease. And there's some estimates that up to half people at first can't digest milk until their intestines start to heal again. There's a lot of thought that people with a variety of different autoimmune conditions, anyone with IBS, should get tested, or even, there really isn't any harm to trying the diet, to seeing if it works for you, and there is a lot of benefit. There is a lot of, potential benefit at the end of the rainbow, and that's part of why it's something you've gotten. Unlike most medications, you really don't have any risk, and you have a lot of potential benefit, and so in a lot of ways it really does make good sense. Part of the reason it's so hard to really sum up the symptoms is just that, on some of the lists, they give up to 200 and something symptoms that have been associated, from neurologic issues, peripheral neuropathies, to things like depression, to things like anxiety, to this, as we said, the skin conditions, the hair conditions. I mean, such a variety of different things, because, our gut and our digestion is such a key part of our overall health. And so it is kind of hard to narrow down. A lot of the symptoms are things that are pretty vague and can be attributed to other things. We used to think, and when I was in school, we used to learn that people with celiac were the itty bitty little child, who was so small and had lost so much weight and was having massive diarrhea and all those different things. And now actually the fastest growing group of people who are being diagnosed with celiac is people who are overweight. And these are people that used to never be tested in the past, because we always thought that someone with celiac looked a certain way, was Irish, was Italian, was a certain ethnicity, was a certain age, was a certain weight, and now we're realizing that just isn't the case.